This next segment is going to be, why should we use guided surgery? What's the importance of doing guided surgery when you're going to place implants? Well, this is a good case to use, the one that's on your screen right now. It's showing the difference between having a guided placement versus an unguided placement. This patient had come to me and needed to have 2 more implants placed. These 2 implants were placed without a guide, and then the patient showed up to my door for me to place implants, and these are the implants I will be placing for them with a guide. Now, this doesn't seem like very much of a difference, but reality-wise, this is quite a difference. When you have cases like this, and these implants are coming out of the facial aspect, it has a significant difference in what we're going to be able to do restorative-wise. Screw retention, or being able to place the implants where these abutments and crowns are screwed down, is an important thing. There have been a few studies done showing that when you do implant placement and you go ahead and you cement retain the crown and bridge work, that there's 80+% of those patients or implants are going to have an infection around them, basically peri-implantitis, which is just basically gum disease around the implants, and implants can get gum disease too. When they are screw retained, that percentage falls off significantly, where about 90% do not have infections around the implants, and that's an important aspect of this. The other part of this, whenever you're in the front, especially a case like this is just a diagnostic wax-up showing where the teeth need to be, and then we have a model showing, you know, where we don't have the teeth added on. So this is just showing with and without the teeth. Okay, so this wax-up showing me where the teeth belong, and this is where we plan on placing the teeth. So what we try to do is we design the implants to match the teeth, not the other way around, like when you place this. So this is where the bone is, let's put the implants in where the teeth come out. And what we end up with is trying to basically build something around a foundation. The goal of any type of construction is you plan it out ahead of time, and then you go ahead and you plan where you're going to put foundation work. It'd be analogous to, again, building a house without having, you know, a blueprint. And why would you want to do that when you should have a foundation? Now, to show you what's going on here, this patient had implants placed prior, and I'm just going to take off all these implants so that you can see that, and we're going to go over here to where these implants are, and you can see that there were implants priorly placed, and they have crowns on them. Okay, so now what I'm going to do is put the implants on here, and what you're seeing is that the implant is lined up over top of the other implant. That way we can check angles and we can see whether or not I can line up these implants with the ones I'm getting ready to place. But then I'm also going to know where the angle of the implant is before we start, and this is just showing you the same this case too, and then I'm spinning it around the corners, basically showing you in 3D that where the current implants are. This patient is going to lose their other 2 teeth, so now we need to place the implants in a position that will facilitate crown and bridge work. In other words, I want to make the teeth where they should be, in a position where the dentist can restore them at the best position possible. So now we're going to go ahead and we'll put the other implants in, which you see here. Again, the 360 degrees around. And what's important to note is these implants are not where the teeth are. Teeth have angulation to them. They come into there, the bone comes out, and then the teeth have about a 20-degree angulation at the end. So the roots end up being in a different place. So to give an example, I'm going to do this. I'm going to be able to undo it, so it's easy enough to do. You see where the root of this tooth is right here? So let's focus in on that root. It's kind of through the plate area, which is the buccal area, or the facial area, the outside area. And I need to put this where it comes in through the area over here where it's on the lingual side, so I can screw retain this. Now, if I were to put this implant where the tooth is, I would have some issues here. But what I'd end up with, it would be an implant over here. And this is not in a position where you can restore it. There's where the tooth ends up at. That situation is making it extraordinarily difficult on the dentist who needs to restore it. And when they make it hard on a dentist, it ends up costing more. There is an additional fee associated with customized or custom abutments. And you don't want to have to use custom abutments when you do these. What happens when you use custom abutments? Well, one is I got to have it made and manufactured in a specific way, which costs more. Two, I end up having to cement over top of these abutments, which leads to more peri-implantitis. And then the final thing is you end up with an aesthetic result that's not as pleasing. So let me blow this thing up again, this picture. You can see where the bone dissolved over here. You could not reinforce this area with a grafting that doesn't want to dissolve very quickly, so that you get an aesthetic result that's like this. What happens is the bone dissolves, and I'm going to show you a finer picture of this. I'm going to turn off these implants again, turn off the abutments, get this out of the way. And what you're seeing here, if you look at this, and I'll get off this 2D view, and 2D view, and you can see how the bone dissolved. These implants are not in an optimal position, and it's not that this doctor did a bad job, it's just that they did it freehand. And the technology is here now for us to do these things in a better way than it was done in the past. And if you can do it in a better way, you do it that way. This is now the 21st century. We don't need to be doing things the way I did it when I was in school, or when, maybe our grandparents did this. So anyway, bottom line is the aesthetics are much better, because I'm going to be able to graft across here in a non-resorbing type of that. Give enough space, put some membranes in here, and keep this space. Basically, I want a membrane that keeps the gum tissues from going into the bone. And you have to have enough space to actually create the graft, and you can overfill it, and it will give you a much better aesthetic result in these kind of cases. Well, bottom line, what do we gain out of doing guided surgery? Implants in a much more optimal position, decreased costs, and having to restore it, and much better aesthetic results. And in